Hi everyone, I am going to be presenting my 15-month progress report. My PhD topic is the effect of oral contraceptives on metabolic balance. My name is Árpád Ágoston Jankó. I am a PhD student and a resident doctor at the Department of Obstetrics and Gynecology at Semmelweis University. I have two specific goals at the moment. My first project is going to be investigating the effect of contraceptives on carbohydrate metabolism in a healthy population, and my second project is going to be investigating carbohydrate metabolism in a population of patients that have PCOS. A short background regarding my project: over 70 million people use oral contraceptives globally. They're so popular because they're effective and comfortable in preventing pregnancies. This 7% failure rate would seem a bit high, but this takes into account occasionally missed doses. But with perfect use, this number is under 1%. It's also popular because of their non-contraceptive benefits. So they reduce acne and dysmenorrhea. And as every medication or drug, this also has side effects. It's suspected that they could cause alterations in carbohydrate metabolism, so they could decrease glucose tolerance and increase insulin resistance, which are risk factors for type 2 diabetes and cardiovascular disease. How these medications alter glucose metabolism, there are no conclusive guidelines at the moment, so our aim is to assess the effect and the safety of these drugs on carbohydrate metabolism. So we conducted a before and after comparison. So we examined a population that didn't take this drug previously and then took it for some amount of time. And we looked at their lab results after. Our outcomes or metabolic parameters were lab work regarding glucose metabolism, especially looking at this oral glucose tolerance test, which I will get to in a moment. We conducted our search in 3 different databases, finally having 116 full text. So before heading on to the next couple of slides, I just have to talk about a short explanation. So we had too many compounds to include into the analysis, so we decided that drugs with similar chemical structure behave alike. So these are going to be the names that I'm going to be referencing in the future. For example, medroxyprogesterone acetate, cyproterone acetate, or 17 alpha hydroxyprogesterone derivatives. So the shorter version is pregnanes, etc. These are the names that I'm going to be talking about in the future, and these are the names that are going to be on the slides. So on the right hand corner, there's also a example visualization, a small diagram. This just represents the oral glucose tolerance test at the different time points, and this is what we're trying to visualize. For example, the black dots are a before value and the red dots are in after, a value that's after usage. So this is just a small diagram to help visualize our goal. So these are our first diagrams. Unfortunately, I haven't received, or we haven't finished our final results yet. But without going into too much detail, looking at these diagrams, we see fasting insulin and fasting glucose levels. So, as you will see on my next couple of slides, having every time frame in its own category would have provided us with too much information. So we are going to have a fasting category, a early category, a peak category, and a late category. Our fasting category is at the 0 point on the glucose tolerance test. Our early category is any time period that's measured before 45 minutes. On the glucose tolerance test, our peak category is at 60 minutes, and our late category is at 90 minutes or higher. So on this diagram, we can see the fasting insulin and fasting glucose levels of the different drugs. The different colors represent the different compounds. For example, the red dots are drospiranon, the blue dots are estranes, the green dots are gonanes. Looking at the previous slide, gonanes are levonorgestrel, desogestrel, for example. The different shapes, so the circles represent monophasic compounds, and the triangles represent triphasic compounds. So without going into too much detail of these diagrams, our short take-home message would be that on this diagram there isn't a huge difference between monophasic and triphasic compounds, but so not going into too much detail on my next couple of slides, these diagrams that I'm going to show you in this presentation are connected to a healthy population. Some conclusions that we can draw from these diagrams without looking at the final results are that there might be a pattern about different drugs behaving differently. For example, one drug could have a neutral effect on carbohydrate metabolism, and another drug could have a negative effect by raising blood sugar levels significantly. So at the moment, these are our results, for example, at the peak population, and these could be our results for the late category, which could be quite interesting to look at, that some drugs could have an opposite effect on blood sugar levels. So there could be drugs that have a positive effect and drugs that have a negative effect in the long term. So this is my progress at the moment. Unfortunately, we haven't received our final results yet because they are a bit more complicated. From my part, I have finished my manuscript. Just need to extend it with the final results. While it's been suspected that these oral contraceptives have an effect on carbohydrate metabolism, us creating these compound-specific classifications based on chemical structure allows us to examine them individually and compare them to each other, which is something novel, something new that hasn't been done before, especially taking our analysis into account, which is a multi-level, multivariable model. Our limitations could include that we have a diverse and fragmented patient population, and we also included non-randomized trials. So our implication for practice could be that these drugs are prescribed currently for psychoregulation and hyperandrogenic symptoms. But these metabolic components should also be considered and studied in the future. To summarize, I have two meta-analyses at the moment. Both of them are investigating the effect of oral contraceptives on carbohydrate metabolism. The first project is investigating it in a healthy population, and the second one is investigating it in a population that has PCOS. And as Kobe Bryant once said, if you're afraid to fail, then you're probably going to fail. Thank you for your attention.